Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. Now, this will be quite an important video, I think. I know from the figures that I get back that the vast majority of my viewers are male, and so this is very important to you. Now, there are obviously some female viewers as well, and I do thank you. Whilst this problem doesn't affect you directly, you will have husbands, boyfriends, partners, fathers, sons, brothers, that sort of thing. And so just be aware, because there's an issue in the NHS that is possibly causing a lot of deaths. It's not being addressed. This is highlighted in this article, and I think it's very important that I highlight it too. So I would ask that on this one, I don't normally ask this, but on this particular one, do share this video and get it out there just so people are aware, so that when they have to go to the GP, they can push. They don't let the GP sort of fob them off or write it down or ignore them or anything like that. Make sure the GP is aware of the concern and get it sorted, and get it sorted early. What we're talking here is about a very particularly male affliction, and that is prostate cancer. Very serious. I also know from my figures that most of my viewers, and by most I mean like all combined, about 80 to 85% of my viewers are over the age of 45. So you are slap bang where you need to be in terms of getting it checked. So do pay attention, because if you have any issues and you go to the doctor, they're not really diagnosing it properly. So here goes. Well, we're going to go straight into this video now. But do pay attention, as I say, do spread the word and make sure everybody is aware of what's going on, and make sure that they absolutely check with their GPs. Here goes. Right, so pay attention at the back. This is important. Men with prostate cancer are being diagnosed late and suffering avoidable early deaths because GPs don't take them seriously, damning figures suggest. Now, this is why I say this is very important. Anything like this, go and get yourself checked. It is a little bit uncomfortable for a very short period of time. It's the old two fingers go up. Wearing a glove, mind. He's wearing a glove, but the two fingers go up. He gives it a wiggle. If there's anything seriously wrong, that's only if the blood tests come back. I mean, they do the blood test for the antibodies. PSA is the test. Prostate specific antibodies they're looking for, and if the count's low, around 4, 5, something like that, then you're absolutely fine. If it goes very high, then you need to get seriously checked, and that's when it's the old rubber gloves and two fingers job initially. It is treatable in an early stage. I know someone who was told he had it, and he was given about 18 months to live, and that was 5 years ago, and the new treatment's coming on. He's still with us. So it is it's a treatable condition, but you need to know that you have it, and it's very important. And this is where the failure is. The doctors aren't doing it. They aren't doing the job properly. Not blaming the doctors specifically. They're very, very busy men. But the whole system is massively oversubscribed. There's too many people to too few doctors. They need a lot more. And that's half the problem. So we'll go through this now. But absolutely, see your doctor. Get the test. Get sorted. Anyway, men with prostate cancer are being diagnosed late and suffering avoidable deaths because they have to fight to be taken seriously by doctors, damning figures suggests. They typically wait longer than other patients before seeking help with symptoms, and then have to return to their GP multiple times before getting a diagnosis. Too many are not told in a sensitive way that they have the disease, or they struggle to contact healthcare workers for support during treatment, according to the NHS National Cancer Patient Experience Survey. Now, one of the things, of course, is men. The problem here, a lot of it, is men. You know what we're like? Oh, we've got this niggle, but we don't want to waste the doctor's time on this niggle, right? Seriously, waste the doctor's time. You paid into the system, and that's what you're there for. And as you get older, these little niggles aren't just the sort of things you shake off in your youth. They could be the signs of something that isn't a little niggle, and is something very serious. So don't sit back and be reticent. Go see your doctor. My 50th birthday present to myself was to see the doctor with every little niggle I have. I don't dick around anymore. No pun intended. Hey, Anyway, a poll of 59,352 patients showed that only 1 in 3 with prostate cancer saw their GP within 3 months of first thinking something was wrong. Now that is down to the men, isn't it? That's down to men. However, once you see the doctor, it's down to the doctor. Anyway, 53.8% of those with breast cancer and 46% of all other cancers saw their doctor in the time. So a lot higher when you've got other things you see the doctor. But prostate is one of the nastier ones, I'm afraid. 1 in 20 men with prostate tumours returned 5 or more times before learning they had the disease, the data reveals. This should be a day one, diagnosis is the word I was struggling for there. It should be a day one diagnosis. You go to the doctor, he should be able to diagnose it quickly. The Daily Mail has relaunched our End Needless Prostate Death campaign in a bid to improve diagnosis and treatment of prostate cancer. It is a massive killer of men. Early diagnosis is key to survival, with just a third of men living for 5 years or more once the cancer has spread outside the prostate. The patient experience survey shows that only 70% of prostate cancer patients were definitely given their diagnosis in a sensitive way, and only 78% completely understood all that were told. That means basically a third of people, just under a third of people, are told in a very unsympathetic way, basically, oh well, you got cancer, you're going to die. That's how bare some of it is. It should be, everyone should be given and done. My mother worked in oncology for an oncology specialist, and it was very hard. She found it very hard because you would basically either seeing the absolute grins of people who were told they were clear of cancer, or that the cancer diagnosis was wrong and they didn't have it, that kind of thing, or you saw the abject misery because they'd been told they had cancer, and worse when they were told they had cancer and it was untreatable. And she said, and they did everything they could to make that the easiest thing. They talked to them, it was quiet, they were sympathetic, they'd listened, and there was none of this 15 minutes, with the doctor. In oncology, the appointment times were far longer because they knew people were coming to do this. It was as much mental as it was physical, and it can be quite brutal. It can be absolutely brutal the way some people are told this. Anyway. Both these results in terms of diagnosis and how they were told were much higher for patients with breast cancer. I think for some reason women are treated softer than men. Men have to be hard and take it because you're a man. And it isn't right. Oliver Kemp, the chief executive of Prostate Cancer Research, said too many men are having to fight to be taken seriously and get tested for prostate cancer by their doctors, leading to late diagnoses and preventable deaths. But when only a third of them go to the doctor, when they think there's something wrong, that's down to us, guys. Seriously, something wrong, go see a doctor. Don't put it down as a niggle. If you're having a little problem there, and it's lasted more than a day or two, go and see a doctor. The earlier, the better. Patients often do not know that they have a right to testing if they have symptoms, and we hear many stories of doctors being dismissive of patients that turn out to have prostate cancer. This is an important message. You can demand and must be given a prostate cancer test. If you have any kind of niggle, see the doctor and tell him there and then you demand the prostate cancer test. They have to give it to you. Demand it. Do not leave his surgery until he gives you the test, or at least signs you up for the test and sends you on your way with the test note. Go and do it. It will save your life. Even once diagnosed, many men don't feel fully informed, adding to their fears and uncertainty. The doctor is the best person to inform you. Dr. Google tends to be a bit dodgy. You can use reliable resources, NHS resources and things online, but there's nothing quite like hearing everything from a doctor and explaining to the doctor and asking questions with the doctor. And for heaven's sake, don't go alone if you can avoid it. Bring your wife, girlfriend, partner, whatever. Bring someone with you for mental support, for emotional support, as well as they also hearing what the doctor's saying and help you understand it later. So there, do it. The high mortality rate for prostate cancer can only be tackled if we end the stigma around this awful disease and make it easier for men to raise concerns with their GP. Screw the stigma. There's something wrong. Get it sorted. He added, it is crucial that doctors have empathy and understanding when talking through someone with cancer diagnosis. Again, the doctors, and this isn't the fault of the GPs, this is a systemic fault. The GPs are so busy because there aren't enough of them. We need way more, at least, and I would suggest at least double the amount of GPs we have now, in order to make the system work. The Daily Mail has fought for nearly 25 years to raise the profile of prostate cancer, a disease which claims a man's life every 45 minutes in Britain. And you do see, I don't have the badge, but you see the little badges of like little sparkly silver badge there of the man-sized badge. That's prostate cancer. That is so important. The death rate for prostate cancer is way higher than breast cancer for women. Prostate cancer for men is higher than breast cancer for women. And yet it is a very rarely talked about thing. That's why this video I'm doing specifically to talk about it and to say, for heaven's sake, get diagnosed, go to your doctor. More than 52,000 men are diagnosed with the disease each year, 1,000 every week, making it the most common cancer among men and the second most common cancer overall. For 10,000 of these, the cancer is stage 4. In other words, 20% of all men who go to the doctor with that little niggle, it turns out to be stage 4, which means it's already spread, it's metastasised, and that is basically the death penalty. An NHS spokesman said in 2021, 5,300 men with prostate cancer who completed our national survey rate the experience of care at 8 out of 10. In other words, it's very good treatment if you catch it early. It is testimony to the dedication of NHS staff that they are continuing to use the insights gained from the survey to improve the service they offer. And the more people use it, the more people demand their rights, the more people listen to the doctor, demand that the doctor explain everything to them, the better it gets. And the treatment is good. The treatment is good. Save your life. Gentlemen, I'm finishing here. And ladies, I'm finishing here. I'm going to come up and round off the video. But please pay attention to what's been said here. Absolutely know your rights. You have the right to demand a cancer test for the prostate cancer. And don't ignore any niggle. Don't be embarrassed. Your doctor has seen a penis before. Your doctor has seen people's bottoms before. There is no part of the human body that the doctor has not previously examined. He doesn't care. What he cares about is saving your life. You need to care about that. You need to see the doctor. Please do. I'm going to come up and round off. Now, we saw in that report that 20% of people who go to the doctor, 20% of men who go to the doctor with this problem, it's already too late. It's the biggest killer of men, and we can make it not the biggest killer of men if we just went to the doctors. When only a third go to the doctor within 3 months. That's giving the cancer a real big help. And cancer is shit. I've known people with cancer. I've known people to survive cancer. I've known people who've died of cancer. I once went away and a man stood in front of me, went away on a week's holiday. A man stood in front of me on the Friday and I was paying him. He was a contractor and I was giving him, he came in, he asked for a week early. He was going away and he needed to see a doctor. He was feeling a bit unwell. He wanted to get it all sorted out early in case anything happened. And I said, anything wrong? He said, no. He said, just got a real bad pain in the back, he said. He said, been a couple of days, it was really sore, so he was going to go see the doctor, but he said, reckons the doctor would give him a few days off. He said he couldn't get out, so could he be paid early? I said, yeah. Don't worry. Wrote the cheque, signed the cheque, handed him the cheque, wished him goodbye. He went off. That was the Friday. I left for the evening. I left a bit early, about 4 o'clock that particular day, I remember. And I went on holiday for a week, and I went to, I think it was Mallorca. And I came back after a week in Mallorca and walked into work on the Monday morning, and my financial director took me to one side and said, John was in on Friday looking for his pay, wasn't he? I said, yeah. He said, did you pay him? I went, yes. He said, good. His wife will need the money because John died on the Tuesday. Turned out that little niggle, that pain in the back, was stage 4 bone cancer, and he didn't know until the diagnosis. And he was told that on the Friday afternoon. He was taken into hospital and he died on the Tuesday. Don't let that happen to you. Don't give cancer that power. You got a niggle? See the doctor. The doctor's not listening? Demand the cancer test. Demand the prostate test. Initially, it's a blood test. They look for the antibodies. It's easy. Demand it. Know your rights. Let's beat this. And let's get those numbers right down. Let's all die of old age. Let's all die in an orgy when you're in your 90s. Let's not give cancer anything. I'm stopping now. Thank you very much for listening. If you've got to the end of this, do please subscribe. Do please share. Absolutely share this video. Let's get the men out there to check themselves, to go to their doctors, to beat this shit cancer. Thank you and goodbye.